I can't wait for more AI in the healthcare system. I think there's gonna be like a lot of fascinating places where this can be helpful, but I'm very excited for more places to take on AI scribes. For those who don't know what that is, it's a program that essentially listens to the physician-patient encounter and then takes the information and writes the note for us. So we just have to kind of review it and make sure it's accurate and then can sign off. I spend so much of my day being a secretary at the computer, writing notes. It drives me insane because that's not why I went to med school. Especially complex encounters like I just came from, where there's a bunch of information. It goes off in all of these different places, and so much information is had in that encounter. It takes so much mental work to put that into like a coherent note that if somebody else looks at it, they know what I'm even talking about or what conversation was had. And I would much rather use that time to investigate that person's symptoms more and try to figure out what's going on than purely just writing the note. And I have seen systems where even like if the conversation is happening in Spanish, for instance, the program will then still write the note in English, which then also takes the mental load away from the doctor trying to translate everything that they had in that conversation with that patient. And then I also found out that there's like integrated systems where if I talk to the patient and say we're going to order a CBC, that the computer will already pen up that order, which is amazing. I think the logical next step is also that AI will help to come up with a differential for the symptoms that were discussed and suggest possible tests or exams. Although AI definitely can be scary if not used appropriately, I think it will be so extremely powerful and helpful within medicine because one physician themselves cannot know everything. And I think partnering with AI will make things better for the patient, make things better for the physician and the healthcare system, and all will be able to see more patients as well because we're not spending our time purely documenting. The doctor tells you that they would like to use this system, seriously consider letting them do it because they will win back time that they can either use to further investigate the symptoms that you're having. They may be able to see more patients, which also means you'll get an easier in the future. And it'll also just make them have better mental health because we'll be able to spend more time doing the thing why we became a doctor, spending time with patients rather than spending time with our computer and writing notes.